Hi everyone, I am Dr. Sandeep Vaidya, Pediatric Orthopedic Surgeon at Pinnacle Ortho Center Hospital. Today we are going to talk about something that worries many parents. So we are going to talk about flat feet in children. You might be noticing that your child's feet look flat and wondering if they need any special shoes or insoles. So today let's clear up some common myths and concerns. First and foremost, it's really important to understand that flat feet are extremely common in babies and young children. In fact, most children under the age of 5 to 6 appear to have flat feet. This is usually completely normal and it is part of their development. Now you have to understand there are two main types of flat feet: flexible flat feet and rigid flat feet. Most children have flexible flat feet. This means that when they are standing, the feet look flat, but when they lift their toes or on tiptoes, an arch appears. This flexibility is usually because of something called ligament laxity. Think of ligaments like rubber bands that hold our bones together. In young children, these ligaments are naturally more loose and flexible. As they grow and walk more, their ligaments tighten and the arch often develops naturally. In most cases, flexible flat feet are just a normal variation and do not cause any problems. So when should you be concerned? Well, most of the time you do not need to be concerned with flat feet in children. However, there are certain specific situations where we need to take a closer look. The key things to watch out for are: number one, pain. So if your child is complaining of pain in their feet, ankles or legs, especially with activity, then that should something which should be looked at. Next is rigid flat foot. So this is completely different. Rigid flat foot are flat all the time. Even when the children are on tiptoes or lifting their toes, the foot feels stiff and does not move easily. Thirdly, look at asymmetry. So if one foot looks different from the other, then that indicates there might be some underlying problem. Fourth, look at delayed milestones. So if your child is a bit delayed in performing certain activities or is clumsy, then it may be a good idea to look at, to see a doctor. Rigid flat foot are extremely uncommon and they are usually due to underlying bone and joint problems. They definitely need to be seen and treated by a specialist. Now let's go to the question of special shoes or insoles. For majority of children with flexible flat feet and no pain, no treatment is needed. Their feet will usually develop naturally over time. Special shoes and insoles are generally not necessary for most cases of flexible flat foot. However, in some situations, we might consider treatment, especially if a child has painful flexible flat foot that is not improving or a rigid flat foot. Certain underlying conditions contribute to flat feet. So treatment options might include observation and reassurance. So in this case, we just monitor the child and time is the best approach. In some cases, we prescribe supportive shoes. So comfortable, well-fitting shoes are always important. And in some cases, we may prescribe special insoles or orthotics. This is especially done in cases of painful flexible flat feet or certain types of rigid flat feet. So these are usually used to manage the symptoms and not to permanently fix the flat feet. In addition to this, physiotherapy and exercises can be taught which can help to tighten up the ligaments. Surgery in flat foot is usually very rarely needed and only reserved for cases where the flat foot is not resolving to the previously mentioned insoles and physiotherapy treatment. It might be needed in certain cases of rigid flat foot. So to summarize, flat feet are extremely common in young children. Most of these are flexible, normal and don't need any special treatment. Moreover, only the rigid and painful flat feet might need treatment. So if your child is experiencing pain, has a rigid flat foot or you have any concerns, please come and see us at Pinnacle Ortho Center Hospital. We and our team are there to assess your child and guide you on the best course of action. Thank you for your time.